This is inside a typical matatu within Nairobi. The music is one of the selling points for many commuters who are youths, oblivious of the continuous damage they expose their ears to. According to Dr. Gakuo Karuga, who is an ear, nose and throat specialist, or ENT as commonly referred, loud music is one of the contributing factors to hearing impairments.
Exposure to loud sounds should be avoided because this is a direct injury to the cells inside the ear, which get injured because of the exposure.
WHO estimates that by 2050, 1 in every 10 people, which is equivalent to 900 million people worldwide, will have disabling hearing losses. Overall, it is suggested that half of all the cases of hearing loss can be prevented through public health measures. A step I decided to take and visit the ENT specialist to have a hearing test done.
The external canal, you can see there's hair, but hair is normal. A little bit of wax, which is very good, that traps the dust.
Dr. Gakuo hits me again with another heart-wrenching statistics of the situation in Kenya.
The figures that have been given by WHO are about 640,000 people living with hearing impairment. Although, of course, I believe the numbers are bigger than that, because many people are actually living with this problem without any awareness or assistance.
Congenital hearing conditions are said to be hard to detect in Kenya due to lack of the neonatal screening machines. One mistake that many people do unknowingly also is using earbuds to clean their ears.
There's no need to clean your ears using anything like any instrument. In fact, we used to be told in school that the smallest thing that should enter your ear is your elbow. So, which means basically nothing should go inside your ear. This is because the ear itself has a mechanism for cleaning.
The two most common hearing conditions that Dr. Gakuo comes across in line of duty is wax infections and chronic ear infections, which leads to discharge of pus from the ear. This leads me to the question, at what point is one recommended to have hearing aids?
This is especially for patients or for people who have already developed speech, who have otherwise been normal and then have developed a problem with hearing. So these hearing aids are useful because what they do is amplify the sound in the canal, and thus the person is able to hear normally and remove the disadvantage that they have.
As a way of mitigating the rise of hearing loss cases, Dr. Gakuo advises that Kenyans should develop a newborn hearing screening culture to ensure that dire cases can be averted at early stages of diagnosis.
But it looks like hearing is normal. This is normal hearing, yeah? Now, if the hearing level was lower, maybe in the red area, then for sure there will be a hearing problem.
Dana Rose, Switch TV.